Greetings everyone. Today I'm going to talk about impulse control disorder. Okay, let's see what is this impulse control disorder is. So how this disorder looks like. If the children are suffering with disorder, these are the children whose parents cannot control them. Or if it is happening to the adults, these adults who simply do not choose to control their behavior. So today I will be discussing about three types of impulse control disorder. ODD, which is the oppositional defiant disorder. Second is conduct disorder or CD. And third is intermittent explosive disorder. We'll also talk about the differences between all these three disorders. The symptoms of oppositional defiant disorder or ODD are following given in this slide, and it involves persistent anger, irritability, defiance, argumentative behavior beyond the normal developmental level. It significantly affects their school performance, their relationships, and family life. Symptom may occur in one or multiple settings. It means it may occur at home or it may also occur at school. Children often prefer immediate rewards and are less responsive to punishments. Many children with these conditions may improve with treatment, but some develop a long-term social and academic problems or progress to a more severe disorders. You see there one of the behavior is a spiteful and vindictive. So spiteful is like impulsive emotional retaliation. Vindictive is a planned revenge behavior. Many childs they improve especially with treatment for their comorbid conditions. They may also have a ADHD along with this disease. So if they take treatment for that, they may improve. The other thing is the parent training. So without interventions, these kids may lead to a conduct disorders and they may have a lifelong social, academic, and behavioral difficulties. Let me go one more time over ODD. These children, they have a defiance, like they say no, and they refusal to follow rules. They have a argumentative behavior. They have emotional outburst, blaming others for mistakes. These behaviors are not intentional, so remember that. Bad behavior, but reflect difficulty with emotional regulation, impulse control, and authority interaction. The key parenting roles are maintain calm and consistent responses, avoid power struggles with them, provide structure, limit, and predictable consequences, reinforce positive behavior more than a negative behavior. So the next disorder I'm going to talk about is conduct disorder. It is a persistent pattern of behavior where individuals violate others' rights and societal rules. It includes bullying, fighting, and you see everything in the screen. To diagnose this disorder, it should minimum last for 6 months. These people usually they enjoy the excitement they get it after showing this behavior, and they do not have any concern for consequences which can cause school failure, expulsion from the school, substance abuse, and some legal issues. This type of behavior can occur in children, adolescents, and adults. If the onset is before 10 years, it may be more severe. If it is happens after 10 years, or we can say in an adolescent or adult, it may be because of the peer influences. And then they may have a low self-esteem. These kids may have low self-esteem and they have a higher risk for severe outcomes. So without treatment, if they're not taking any treatment, they have a risk for juvenile delinquency, substance abuse, and criminal behavior. And this type of behavior can lead to antisocial personality disorder, right? If they're showing this behavior, if this behavior continues after 18 years, it's considered an antisocial personality disorder. Early and invasive interventions improves the outcomes. The treatment is multimodal. It means we are involving family, we are involving schools, sometimes medications, only if they are showing a anger outburst or for their uncontrolled behavior. If these kids keep showing those type of behavior, so they may be kept in a therapeutic group homes or residential programs. If they are dangerous, they have a severe family dysfunctions and they have a failure of outpatient treatment, so we have to put them inside the group homes or residential programs. This slide shows the difference between conduct disorder and ODD. Conduct disorder involves the more serious violations of others' rights, whereas ODD involves angry and defiant behavior. Conduct disorder is more severe as compared to ODD. Conduct disorder includes aggression, stealing, lying, whereas ODD involves the tantrums and arguing. Conduct disorder usually happens after the 10 years of age, but ODD is more common for a kids less than 10 years. The third type of impulsive disorder is IED, which is an intermittent explosive disorder, and it is when someone has a trouble controlling their temper. So basically it leads to sudden outburst of rage, aggression and destruction. They usually get a relief after that outburst, and then they feel very bad. They have a guilt feeling, they feel embarrassed and remorse. So the risk factor for disorders can be a genetic or biological, or maybe because of substance abuse. They may have a brain injury or psychological or behavioral factors. Okay, let's summarize. ODD, oppositional defiant disorder. I won't listen. These kids will say no. They do not listen to the authority figures. Conduct disorder, CD. I break rules and harm others. They are more towards the criminal issues. IED, I explode and then I regret it. Right? So these people have impulse control issues. So that is a summary of all those three. And we know which is the most severe one. The conduct disorder is more severe one. IED can be severe if they have done some harmful stuff during their explosion, right? The core nursing interventions for all these three disorders are: ensure safety for patient and others, build a therapeutic record, set clear limits and expectations, apply consistent consequences for rule breaking, provide structured boundaries and routine, encourage purposeful activities and achievements. Let's summarize. ODD defies authority, conduct disorder intentionally violates rights of others, impulsive IED is impulsive rage with no planning. The another summary is ODD, they have an angry and irritable mood, conduct disorder shows low empathy, possible callousness. IED people have a rage, then they get relief, and then they have a remorse. Again, you can remember in, either one of this you can remember. So the last one is the ODD. They say no all the time, no, specifically towards the authority, maybe nurses, doctors, parents. Conduct disorder, I will break the rule and harm others. IED, I am going to explode and then I'm going to regret afterward. Okay, so I just want to tell you that recognizing and treating aggressive and impulsive behavior while a person is still young can prevent further problems and avoid interactions with the criminal justice system. But unfortunately, stigma and misconceptions around mental illness may cause individuals and their families to conceal this condition. Concealment can limit help seeking and professional care, preventing timely interventions. Unfortunately, without professional care, many young people end up interfacing with the criminal justice system where treatment may or may not take place. Okay, so I am going to end my presentation here, and all the best to everyone. Let me know if you have any questions. You can write it in the comments. Thank you so much.